Good morning po. I am Patricia Reyes Castillo from BSN 2-9, and today I will be presenting a drug literature about CO-AMOXICLAV Natrabox. So the generic name of CO-AMOXICLAV is amoxicillin clavulanic acid, and the brand name is Augmentin Clavamox CO-AMOXICLAV. So now let's talk about the history of CO-AMOXICLAV. Amoxicillin clavulanic acid, also known as CO-AMOXICLAV or AMOXCLAV, sold under the brand name Augmentin, among others, is an antibiotic medication used for the treatment of a number of bacterial infections. CO-AMOXICLAV was identified in 1972 by a group of scientists in Beecham, now GlaxoSmithKline. It was launched as Augmentin in the UK in 1981, and it is a combination of clavulanic acid and amoxicillin. Amoxicillin clavulanic acid was approved for the medical use in the United States in 1984, and it is on the World Health Organization's list of essential medicines. The World Health Organization classifies amoxiclav as critically important for human medicine, and it is available as a generic medication. So in 2021, it was the most commonly prescribed medicine in the United States with more than 5 million prescriptions. And this antibiotic is also used in veterinarian practices, commonly given to farm animals against similar infection. So for the indications and contraindications of co-amoxiclav, let's talk about the indication first. For the treatment of infection caused by a susceptible organisms in the upper respiratory infection, like sinusitis, otitis media, or recurrent tonsillitis. For lower respiratory infection, examples are acute exacerbations of chronic bronchitis or bronchopneumonia. Genitourinary tract and abdominal infections, in particular cystitis, septic abortion, pelvic or puerperal sepsis, and intra-abdominal sepsis. And lastly is the skin and soft tissues infection, in particular cellulites, animal bites, and severe dental abscess with spreading cellulites. For the contraindications, co-amoxiclav is contraindicated with patients with a history of allergic reaction to any penicillin. It is also contraindicated in the patient with a previous history of amoxicillin potassium clavulanate associated cholestatic jaundice or hepatic dysfunction. Let's move on to the pharmacodynamics and pharmacokinetics of co-amoxiclav. Pharmacodynamics: clavulanic acid inactivates some beta-lactamase enzymes that are produced by bacteria, therefore preventing enzymatic destruction of amoxicillin. These help to treat a variety of bacterial infection which would otherwise be resistant to antibiotic without the addition of clavulanic acid. Next is the pharmacokinetics. Amoxicillin and clavulanate potassium are well absorbed from the gastrointestinal tract after oral administration. Amoxicillin diffuses readily into most body tissues and fluid, with the exception of the brain and the spinal fluid. The result of experiments involving the administration of clavulanic acid to animals suggests that this compound, like amoxicillin, is well distributed in body tissues. So for the side effects of amoxiclav, amoxicillin clavulanate potassium is generally well tolerated. The majority of side effects observed in clinical trials were of a mild and transient nature and less than 3% of patients discontinued therapy because of drug-related side effects. Like all medicine, this medicine can cause side effects, although not everybody gets them. The most frequently side effects were diarrhea, nausea, vomiting, headache, skin rashes, and urticaria, and lastly is the vaginis or vaginis. Now let's proceed to the drug interactions. Probenecid decreases the renal tubular secretion of amoxicillin. Concurrent use with co-amoxiclav may result in increased prolonged blood levels of amoxicillin. In common with other broad-spectrum antibiotics, co-amoxiclav may reduce the efficacy of oral contraceptives. Next is the pregnancy and lactation. There are, however, no adequate and well-controlled studies in pregnant women because animal reproduction studies are not always predictive of human response. This drug should be used during pregnancy only if clearly needed. Now let's discuss the dosage and administration. So this is the dosage and administration of co-amoxiclav. Most infections, adult and child, greater than 40 kg, 250 mg every 8 hour or 500 mg every 12 hour. For recurrent persistent otitis media, child 3 months, 90 milligram kilogram a day. For lower respiratory infections like otitis media, sinusitis, skin-to-skin structure infections, or UTIs, for adult, 250 to 500 milligram every 8 hour or 500 to 875 milligram every 12 hours rather, depending on severity of infections. For child less than 40 kilogram, 20 to 19 in divided doses every 8 to 12 hours. Community-acquired pneumonia or acute bacterial sinusitis for adult 2,000 milligram. And lastly, for renal disease 10 to 30 ml. Tablets. Tablets should be swallowed whole without chewing to minimize potential gastrointestinal intolerance. Administer at the start of the meal. The absorption of co-amoxiclav is optimized when taken at the start of a meal. The duration of therapy should be appropriate to the indication and should not exceed 14 days without review. So this is the usual adult dose. For mild to moderate infections, 375 milligram tablet 3 times a day or 625 milligram tablet twice a day. For severe infections, 625 milligram tablet thrice a day or 1 gram tablet twice a day. For dental infections, 375 milligram 3 times a day for 5 days or 625 milligram tablet twice a day for 5 days or as prescribed by the physician. Administration. So for PO route, do not break, crush, or chew, only as directed. 250 milligram tabs are not equivalent to 500 milligram tabs due to the strength of clavulanate. Third is shake the suspension well before each dose. It may be used alone or mixed in drinks. Use immediately and discard unused portion of suspension after 14 days and store in refrigerator. Give around the clock and lastly give with a light meal for increased absorption, fewer GI, and effects, confusion, behavioral changes. So now let's discuss the nursing considerations. The first thing we need to do is to assess bowel patterns before and during treatment, as pseudomembranous colitis may occur. Next is to report hematuria or oliguria, as high doses can be nephrotoxic. Third is to assess the respiratory status. Fourth is to observe for anaphylaxis like rash, itching, dyspnea, facial laryngeal edema, or skin eruptions. Fifth is to ensure that the patient has a adequate fluid intake during any diarrhea attack. Next is to evaluate therapeutic response like absence of infection. And lastly is to teach patient and family about CO-AMOXICLAV. So first is to take as prescribed, not to double or skip doses. Second is all aspect of product therapy. Complete the entire course of medication to ensure organism that culture may be taken after the completed course of medication. Lastly, that product must be taken in equal intervals around the clock to maintain blood levels. So now let's hop into the next slide, which is analyze and present current research and evidence-based practice guidelines related to the specific drugs. So it is the suitability of amoxicillin clavulanic acid for administration via prolonged infusion. So the provided research findings suggest that co-amoxiclav is suitable for administration via prolonged infusion, highlighting the potential to optimize the use of existing broad-spectrum antibiotics in the face of diminishing new antibiotic discoveries. The stability indicating HPLC method developed and validated in compliance with International Council for Harmonization demonstrated that co-amoxiclav remained stable at clinical concentration when stored at different temperatures and diluted in various solutions. The data indicated that co-amoxiclav stability was superior to previous proposal, which support its suitability for extended infusion therapy. The study found that the degradation of amoxicillin followed a linear trend with higher temperatures leading to elevated rates of degradation. The analysis of regression slopes via ANCOVA demonstrated that both diluent and temperature significantly affected co-amoxiclav stability. Notably, the research demonstrated that amoxicillin retained 90% of its initial concentration for 7.8 to 10 hours when stored at 4 degrees Celsius, 5.9 to 8.8 hours at ambient temperatures, and 3.5 to 4.5 hours when incubated at 37 degrees Celsius. This finding supports the conclusion that co-amoxiclav is suitable for prolonged infusion, providing valuable insights for ameliorating current dosing regimens to optimize antibiotic efficacy. Furthermore, the study suggested other valuable applications, such as the ability to prepare solution for use in bolus administration, which could minimize preparation time and reduce workload for healthcare providers. Overall, these research findings contribute to the evidence-based practice guidelines related to the optimization of amoxiclav administration, offering potential benefits for addressing antibiotic resistance and improving patient care.